meeting of the Healthier Communities Overview and Scrutiny Committee, and can I also welcome those people that are watching this via the webcam. My normal thing, if you've got a mobile phone on you, can you make sure you've got it turned off, please? Go on, straight on to agenda item 1, attendance. Have we had any apologies?
No apologies have been received.
The attendance register is going round, so if you can please sign it. Item agenda 2, declarations of interest.
Chair, I'm not aware of any interest that need to be declared, but if members have any questions, I'm happy to answer any queries. Thank you, Chair.
Any questions? No? Thank you. Go on to item agenda 3, future meetings, timings and attendance. I've added this to the agenda this week because I've received a letter from the chair of the Ethics and Standards Committee, and I'll quickly read it out to you. It says, "Dear Chair, you will be aware that the Ethics and Standards Committee receives regular reports on the attendance of members at Council, Cabinet Committees and policy seminars. They received the latest report at their meeting on July the 9th, and that is available on the website if members want to review it. The committee looked at these figures with a view to suggest improvements to increase attendance and thereby help members to discharge their duties. While some meetings, such as Council and Cabinet, have healthy attendance records, others do not. I have written to the group leaders and individual group members separately, but the committee also asked that I write to all committee chairs, i.e. me, encouraging them to review the timings of the meetings and to consider other ways in which they might improve attendance." So with that in mind, I think we've got two areas. Do we wish to continue with the pre-agenda as we've held it today, i.e. an hour or so before the meeting, or do you wish to revert back to the system we had before, where we held it a couple of days beforehand, and that gave the supporting officers time to prepare the questions? I don't want to be dictatorial on this. I don't want to impose anything. I wish us to discuss it, and then we'll come up, if necessary, we'll take a vote on it. Does anybody have any comments?
Chair, as I got a second job, obviously I rather to be one at a time, like the same what we're doing now, rather than we have to break up the days and put another days. I'm working anyway, so thank you.
Yeah, appreciate it. Anybody else got any views on it? So, Barry?
Chair, I would like to split it into days that we give officers as well a chance to do things where, this way we're doing it at the moment. It seems all rushed and you cannot get everything prepared and ask the right questions. Thank you.
I agree with Councillor Barry Taylor that, it is a bit pushed. Following on, I much preferred it to what we had before, and we had, we had more time to have a general discussion on it, so I'd prefer to go back to the normal way that we was before.
Yes, thank you, Chairman. Yes, I agree. I think it's too rushed the way we've done it today. If we do it a day or so before the meeting, it gives the officers as well as members time to, get their thoughts together and perhaps go through the report again.
I just think it's the first time we've actually done this structure, and I think by having it a couple of days before, it does give you more time to generate any questions and officers as well.
Nigel, you're the only one who hasn't commented.
I have to say that I go with the majority view. I think that the system that we've tried today doesn't feel as comfortable as the previous system. I can understand we're trying to make sure that everything gets done in one day. I can understand that. But I have to say that I felt more comfortable. Is that psychologically I felt more rushed, knowing that, it's got to be done today.
Maria, do you want to come back?
Chair, I'm happy with the suggestion of my colleague, but I guarantee I'll be in the actual committee meeting, but the pre-agenda I might miss. the pre-agenda.
Fine. I appreciate what you're saying, but what we can do is to make sure that we can email you and any comments you wish to be brought up at pre-agenda can be done. So I take it the general consensus across everybody now is that we revert back to the previous system where if we've got a meeting on a Wednesday, we have the pre-agenda on a Monday. Okay. The other thing is, and again, if we can discuss it and come to a general consensus, timings of the meetings. We've always held it on a Wednesday afternoon at 1:30 or 2 o'clock. Do we want to stay like that, or do we want to perhaps have it in the morning? As long as the chamber is not booked, we can have the meeting whenever we want, not what we've always done it, because we've always done it that way. Anybody got any thoughts?
Sure, personally, I prefer morning. We got fresh mind in the morning rather than leave it too late in the afternoon. Thank you, Chair.
I must admit, I personally agree with you. I would rather do it in the morning. I feel otherwise we're sort of rushing to make sure, whatever we've got planned in the morning, we're rushing to make sure we get here in the afternoons. Okay, so people are nodding.
Chair, I'm happy either way, but I think perhaps for change, you know, if people feel that it morning would be better, let's give it a chance.
I'd like to try mornings because I got to be honest, this time of day is pretty down for me, like, you know, so I prefer mornings if possible.
Okay, anybody else want to say anything? Mandy?
Well, could I?
I'm quite happy either morning or afternoon, but I think you've got to go with the consensus. We want members to get the right attendance. That's what we're trying to do. So,
Chair, I would go with morning. It's because the thing is that many of us is, of course, there are so many other meetings that we have that we're involved with, and they're more likely to be afternoon or early evening. So I would, I'd like to give morning a try.
Anybody else want to say anything? Norma?
I would have said leave it as it is, because if people work, and there are members who work, they can have their morning in work and then be in the Civic Centre for the afternoon.
But it works the other way round. They can have the morning off and be in work in the afternoon. All right.
I suppose, but...
Do we need to put it to a vote, or can we put it to a vote? Those who want to have try having a meeting in the morning. That's
1, 2, 3, 4, 5, 6.
Right. Oh, okay. So we'll give it a try at the next meeting. We'll arrange to hold it in the morning. Okay. Thank you.
What sort of time
What time are we looking at? 10 o'clock. Then we would aim to finish by about 12:30 at the latest. Okay. Thank you. Thank you for that. Item agenda 4, minutes of the previous meeting. We start on at page 5. At page 1, page 2, page 3. I know everybody's read it. Page 4, 5, 6, and 7. So everybody's happy that they're a true record. Anybody want to bring anything up or make a comment on anything? Thank you. So we confirm the true record. Action sheet, which starts on page 13. Helen.
Only one action, members. It's the relating to adult services redesign and remodelling of services for adults with learning disabilities. We've received the recommendations back from the Chief Officer, and they've been circulated to the committee members.
Thank you. Go right on to agenda item 6 then, which is the main agenda, starting on page 15, main agenda item. We've got 3 expert witnesses coming in this afternoon. The first one is Anne Sheehan, who works for Children's Services. The second one is Duncan Forbes. I think we all know Duncan Forbes from Bronavon. And the third is Keith Rutherford. So we all know Keith. So should we ask for the first person to come in, please? Hello, good afternoon and welcome, and thank you for attending. Could you give us a quick overview of what your role is, please?
There, okay. My name's Anne Sheehan. I'm a group manager with the Children and Families Division of Social Care and Housing. And in respect to the matter we're discussing today, I'm the Social Services Children and Families representative on the Prevention and Early Intervention Strategy Project Group.
Thank you. Can you turn it? Sorry, I know it's awfully, but when you need to speak, can you speak it? And then can you? Sorry, yeah. We've all read the report, so we don't need to go over the report. Can you basically tell me what is being delivered completely differently to what was being delivered before because of this strategy?
Okay. It's a matter of how it's being delivered, I think. You will have seen from the report that Families First, Communities First and Flying Start, all grant funded by Welsh Government, were operating at an early intervention level. What we have done with this strategy is to align those different services and to bring them together so that it's more coordinated. And the families that are being offered support are referred to the Family First panel, and a lead worker is appointed. So the principle of working then is to work with the whole family, the team around the family, rather than to work with just an individual part of the family, which some of the projects were doing. So we're looking at working holistically with the whole family. So the services were already there, but they weren't as aligned as they are now.
Is there an action place, and how often do you look at it to make sure? Is there an action plan in place?
Yes, there is. The strategy, which I think is attached as an appendices to the report, does have an action plan. We have regular meetings on a monthly basis, and the different elements of the action plan, I think, are fairly well developed in how we're taking them forward. So, for example, we had the formal launch in March. I think many people were invited to that. We've been training professionals across the field on how to make a referral to Family First, what to do when they've identified something in a family they're concerned about. We've seen the training go well, and one of the things that came out of the training was actually more of the staff saying, we know how to refer now, but now can you train us on how to be a lead professional? And so that's the next part of the action plan, is to deliver more training to the professionals who are delivering the strategy with us.
Norma?
Thank you, Chairman. The panel, as you call it, there aren't any new organisations involved in it. They're all organisations that are already in existence. So how is it going to be any better?
When I came to work here in Torwine 2 years ago, there were no panel meetings from Family First. So I think what I would say is that what we have done during the last 2 years is to form a cohesive multi-agency panel with representatives from a wide range of agencies who come together to look at the referrals. And the number of families that have been referred have gone up significantly. There was no panel, then it was a slow start, and now the panel happens every month, and families are discussed in some detail, and a relevant agency is chosen to work with them. And I think because it's more coordinated, we may not have different services, but it is much more coordinated. And this is early stages yet.
Just ask the referrals. How are the referrals actually made? Who makes? I know there's a multi-agency working on it, but how are they picked up, the referrals?
The referrals Do it again. The referrals are sent through to the team around the family coordinators who work for Families First, and there are two of them, one for the north of the borough and one from the south, and the referrals go through to them and then they're discussed at the panel meeting. Occasionally they may be allocated before a panel meeting, but that's the process.
But can I, if a family needs help, do they know where to go for the help? You know what I mean? I'm, you know, the link to the panel. I can't see.
I think
really
what
how...
Councillor Paris is trying to say is, how do the families self-refer into the system? Is that what you're actually trying to get at?
Usually it's the professionals who refer the families in. We have had some self-referrals, but what the Family First team have done is produce leaflets so that families are aware of the, they produce leaflets so that they can, and they've left them at suitable places, libraries and surgeries, so that families know how to refer if they need assistance. So we have leaflets for professionals and leaflets for families.
Have we actually put anything in Torvine Talks, or is it on the website?
It's on the website. You know, I don't know. I will actually have to check on that. Advertising of the strategy is one of the things that's part of the action plan and how we take that forward.
See, earlier you were talking about how the staff were trained, and I managed to get a copy of the overheads that were used. I appreciate the other members haven't got this, but one of the overheads, it's come up that for some, this training raised more questions than it answered. Can you actually explain that, please?
I think, as I alluded to a little earlier, the first tranche of training was really aimed at helping people to understand how they could make a referral to the Family First panel. We hadn't expected staff to really want to know more than that at that point, but what it raised for them was that at some point in the future it may well be the professionals who were being trained who might need to take a lead as a lead professional with the family. And we had a group of people who weren't ready for that. And so it raised questions about, well, what happens if I'm asked to be a lead professional? How would I go about that? And so that was why we've designed the second tranche of training, which is going to be delivered from September onwards, to help people understand how they would take on that role and what it means.
Thank you. Just to let you know, I'm sure you are aware, a number of the committee went and met with some of the professionals on Monday, and we had a very, very good discussion, and they gave us these referral forms. And can I just say, the way you've got that at the top is absolutely brilliant, I think. It's such a change. It's such a change from the smiley faces we've always used. It's brilliant, I think, and it works well. When we've scrutinised as a committee things in the past where there have been different agencies involved, we've always come across a constant theme, is that when things go wrong is because agencies, they don't communicate properly. How have you made sure that that doesn't happen in this case?
Does your question relate to the agencies that might be working around a family or within our strategy itself?
Well, all of it, yeah.
Okay. The team around the family model is one that's been promoted by Welsh Government within the Families First arena. And I think the idea that a family should have a joined-up plan is at the heart of it. Now, I accept that there are occasions, and in social care we probably are very well aware of that sometimes agencies don't communicate as well as they could. But what we're trying to do with the training about lead professionals is to help them understand how to coordinate a plan and how to set goals and outcomes for the family that are achievable by the family, and how those will be monitored on a regular basis by the agencies. And so keep a channel of communication open at all times. So that's at an operational level. At a strategic level, I think our multi-agency implementation group is actually working very well. We have a number of different people from different sectors, and it's quite a creative and quite an exciting project to be part of, because the way individuals are relating to one another and actually want to drive this forward. So at the moment, I think at a strategic and operational level, we think that we've got the bones of a very good project here.
Nigel.
Thank you, Chair. One of the concerns, which is I've heard in other contexts, I think works here, is that there are certain organisations that they have different remits, plus also that they're based on different things. I mean, for example, Flying Start and Communities First are both about the place, whereas Families First is about families and can take in the whole the whole of the county borough. One of the fears that I have, and I think certain other people have, it's about turf rights, because you live in the Communities First or Flying Start area, therefore you must go to Communities First or Flying Start. Whereas if you don't, then you go for Families First, and I think that's something which concerns me.
Contemplating that. I mean, Flying Start and Communities First are targeted at particular areas where the deprivation is significantly higher. Families First covers the whole borough. Welsh Government have given us funds to deliver services in that particular way. I know that we've been having conversations at a very high level with Welsh Government to suggest that on certain occasions we feel that that is not the fairest way of delivering services across a whole community. But we have the funding at the moment according to the rules of Welsh Government, but negotiation is going on to see what shifts can be achieved by us joining together to have this strategy. And certainly when we had our launch in March, there were representatives from Welsh Government there who we'd invited and who were very interested in the way we're taking this forward in Tulheim.
Thank you, Chair. Reading this report and reading about Flying Start and going on, it says that Flying Start is in Blanavon, Pontywenyd, Pennygarn, Thornhill, St Giles, Fairwater, Green Meadow and Northville. Now, I will take, for example, where I live, and I represent Snatchwood. But when you say to people Pontywenyd, now, that is a different ward, but there are areas of Pontywenyd that people in Snatchwood live, and how do you define these boundaries? Because people in Pontywenyd will say, I live in Pontywenyd. They don't. They're in Snatchwood. They're not in Pontywenyd. So how is this defined? Could you ask?
I think it would be for the Flying Start coordinators who might be best placed to answer that. But I will say that in my experience, if there is a vulnerable family who would benefit from, because they're all young families who have support from Flying Start, and they may just be outside of the boundary, then discussions take place, and very frequently that family gets that service. And I've seen that happen.
Carrying on from that, Communities First areas are included in this, but that doesn't cover the whole of the borough. And I can see, people falling through, the net, if you like, because they don't come into the areas that are having these services.
I think I refer back to my previous answer, really, where we are in discussion with Welsh Government about how we deliver this strategy. But the main purpose of this strategy is to ensure that all the vulnerable families and children and families within the borough do have access to an appropriate service. And if on occasions a Communities First or a Flying Start area is unable to deliver a particular service, then I'm sure that one of the other Families First services may very well be able to target that family, because the aim of this strategy is to deliver right across the borough, and as a strategy we're not comfortable with the idea that there should be pockets that are excluded. I think the vision for the strategy is it covers the whole borough and for all vulnerable families.
Yes. I still can't see that it is going to be borough-wide when you've got these places that don't have the same services in places as other areas. Yeah, you know, to me, it's a bit haphazard, you know what I mean? You're saying you hope it'll cover the borough, but by what you've said, I can't really accept that the borough will be covered in the same way by the same organisations.
One of the aims of this strategy is to review all the services that have been commissioned, whether it's Families First, Communities First or Flying Start, and look at the borough as a whole and see where there might be gaps and how those gaps might be addressed. Each of the strategies thus far have been commissioning on their own, and one of the purposes of coming together is to actually undertake that whole review of all the services across the borough, identify where there are gaps, and work out a way of actually delivering the service. That's the strategic aim of the strategy, not to be fenced in by the smaller operational areas that you're talking about.
Yeah, I just wondered, if a referral comes in, is there a criteria that has to be met? Because, I mean, on your leaflet, TAF is not a guarantee of service, so is there a list of criteria which has to be met before they can have assistance?
Thank you for my idea. In the report, I think you'll see it's 516.1. What we have done is to develop this continuum of need, which is a guide for professionals. I'm happy to leave this copy. It sets out the universal needs of families, then in tiers 2 and 3, the sort of emerging needs, then the more complex needs, and then at the fourth tier, the statutory level of intervention where children are at risk of harm. And it sets out scenarios to help professionals, to guide them as to the right course of action to refer. So I'm more than happy to leave that. In fact, there was a suggestion, I think, from the Director, Sue Evans, of Social Care and Housing, that at some point it might be helpful to have a member seminar on this document itself. So we'd be happy to do that.
That leads me on nicely to my question is, how will this strategy address the gap between the existing lower level early and preventative interventions and the eligibility for the statutory services?
I think it will help by assisting professionals across the whole of the borough to understand the sorts of situations where children and families may need some help, and that they are able to work with families to prevent families in crisis reaching the statutory thresholds where we see children suffering harm. So the aim of this strategy is to work at levels 2 and 3, really, to identify families in difficulty early, and then to work with families where there are complex situations, some of the harder to reach families, so that they can be assisted before a crisis becomes the sort of crisis that harms their children.
you can see our concerns. We are being told in different seminars and so forth that the council is constantly reviewing the criteria for which people are eligible for services, and we are concerned as a committee that there are gaps going to emerge and people will continually not fit the criteria that is needed, so therefore they won't get the early intervention that we would hope they would get to stop the problem escalating so that they then become eligible.
Within Children and Family Services, the criteria for a service is pretty much defined by the Children Act. Children in need or children in need of protection. And the focus and energy is always on providing those statutory services to the most vulnerable children. The local authority, I think, has been unable to focus resources on the lower levels to prevent families reaching crisis point. And so I think the purpose of this strategy is to harness the enthusiasm and energy of the other services which we know are available, which are in this report, to meet the need of those families at that level 3, to prevent them becoming families in severe crisis. But in terms of children and families, I think we haven't redefined our thresholds at all. That is set by the Children Act. But our main focus in statutory work and with disabled children is to ensure that as much as possible their needs are met and they're protected from harm.
Thank you, Chair. What role do you talk about organisations, but specifics? The biggest one, of course, is schools. What role do they have? How are you working with them, etc., etc.?
Strategy. There are very close liaison between the team around the family coordinators and the different schools across the borough that have family liaison officers who and much of that is paid for by the pupil deprivation grant. And those family liaison officers can identify a family fairly early on, or a child who's not coming to school, pick up the problem early on. And frequently the referrals that come in to Team Around the Family, Families First panel, are from schools, so working very closely. And then, of course, in the statutory services, in Children and Family Services, we have very close liaison with all the schools.
This committee, a year or so ago, we went to Pennegarn School and met up with one of the family liaison officers. But not all schools have family liaison officers, because the thing is that there's some schools which are considered below that line, but they might have. But the thing is that there could be a child with a problem even in the schools which don't qualify under that under that line. How do we? Are you working with teachers and so forth to see how they can spot these signs?
Yes, every school, whether or not they have a family liaison officer under the pupil deprivation grant, will have a child protection coordinator and a staff member whose responsibility it is to assist children who are looked after. So every school will have one of those, and we work closely with them.
I'm just wondering, if, when we went on Monday, we discussed other family members making referrals, and there was a gap that they said that it would have to come from a parent, or they'd have to work with a parent. How would you, if a family member reported a concern, could that referral be taken up further then?
That's common practice in social care and children and families, common practice, yeah.
I think one of the things we discussed on Monday, whether we like it or not, there is still a social stigma for people that are referred to social services. And there is still a reluctance of families to self-refer because there is this belief once social services become involved, everything escalates and I could lose my children. How do you overcome that?
That's a tricky one. That's a tricky one. I'm not sure it is easy to overcome that, Chair. I mean, the main focus of this strategy is to get help to families early on, to prevent families getting into crisis, to help children achieve their outcomes that are the best outcomes for them. Children sometimes do suffer harm, they do suffer neglect, and the statutory services, Children and Family Services, have a statutory duty to assist with that. That causes tension. It causes tension with families, it causes tension in communities. That doesn't mean to say that the statutory duty has to be carried out. What we really want to do is to prevent families getting into a crisis where their children are harmed, and that's the main purpose of what we're trying to do here with the strategy.
Nigel?
One thing. What's your relationship like with third and voluntary sector?
There are voluntary organisations that are providing support within the wider Families First arena, but they are commissioned services. So the relationship with those commissioned services is a business-like one. I think one of the things that we have accepted, and that there is, I think, some work going on within the borough, is to strengthen the alliance between the voluntary sector and the local authority.
Does anybody else have any questions they would like to ask of Anne?
I just wondered if there's any, in your opinion, any agencies which there's a gap which could be improved in your... Do you think something could be done more by a certain agency to improve the service?
I think one of the things that we have struggled with a little is the community mental health service for children, the CAM service. Although what we are seeing is that the primary mental health service is beginning to provide some quite innovative services in the borough, which are open for all. We had a presentation only last week from the primary mental health services talking about open sessions, free sessions at the leisure centres to help people who are feeling stressed, help people with their well-being, and all of this actually is an important part of actually giving people the skills to prevent a crisis, to develop resilience. So we were quite heartened to see that. It isn't fully addressing the gap that we've identified about CAM services, but it did feel as though that, coupled with consultation, was a beginning way of assisting with that.
Everybody happy? Can I just say, Anne, thanks so much for coming in, and you've given us very comprehensive answers to our questions. Appreciate that. Thank you. Hi, Duncan. Thanks ever so much for coming. I think you know everybody here. We've all read the report and the appendix, and I think we all appreciate as well is that the strategy is not just about looked after children. It's much wider than that. That's one of the things we are aware of. And just for your information, on Monday, a number of the committee went and spoke to a number of the staff that are actually delivering the service. So we got a lot of information from them. Can I ask you, what do you feel will be delivered completely differently because of this strategy?
Well, I mean, the proof of pudding will be in the eating, really. But what we're seeking to achieve, I suppose, is a uniformity of approach across as many different services as possible, to make sure we're doing the assessments in the same way and making sure we're doing the planning with families in a different way, essentially engaging the families far more in the planning of their services around them, but also focusing on building people's independence rather than dependence, as a sort of a different approach. So what we hope we'll have is a much better picture as we start to capture more and more families in the system of the extent of needs across the borough. Because what happens at the moment is that when we did a quick study amongst sort of a number of different preventative services, we found, for example, 15 or 16 databases being used by different services, each recording information about a family or a person within the family, and none of which were being shared with other services. So that's a very big waste of time and effort for starters. Secondly, it doesn't enable people to work together to plan very easily. And the lack of coordination between preventative services and indeed between social care and preventative services is a very, very inefficient way of delivering services and very, very confusing for families. So what we hope we'll do differently in the end, I suppose, is that families will see a different approach in the sense that they'll feel they've got one person as a key worker who they know who they are and have a trusting relationship with, who can then sort of broker the connection with other services where necessary. So that's number one. Secondly, the services will be much more focused around what the families identify as their immediate needs rather than what professionals might selectively choose to deliver as needs. Because if you look at services, how they're funded, most preventative services are funded on a silo, either of geographical area, like Communities First, or age, like health visitors, or issues like mental health or domestic abuse, or there's probably others. But essentially, if you have nobody has just those needs. There are needs outside the geographic areas where it's provided. There are needs outside. If a family has a child who needs a intensive help as a 3-year-old, they may well have a 6-year-old who also needs intensive help. But that's outside the scope of the funding for the service that's being provided. If a woman is suffering from domestic abuse, she may also have mental health problems, but that's outside the scope of the services that are being provided. So all those silo services are being delivered, often to the same families. And we had, when I did a piece of work with Stuart Greenwell, when he was Director of Social Services or Chief Officer of Social Services several years ago, we looked at several families, and we found one family with 9 support workers who didn't know each other existed. Because they were each dealing with one issue. So what we hope to achieve, I suppose, is that we focus on what the family's issues are, rather than it being dictated by what service is being delivered, and we can then build the package of services around the family, in the team around the family approach, which is inherent in the model, helping them build what we've called resilience. So what we want is families who can sort their own problems out, perhaps with occasional support when there's a crisis, but largely we avoid crises in advance. Because otherwise what we found is families will just lurch. We'll solve one crisis and then another one will come along, and they're not ready for that one either, because people are living on a day-to-day basis rather than having any sort of opportunity to plan. So I think, hopefully, I mean, what we've found from the services being provided already is that all sorts of benefits. We've had kids getting into school who weren't going to school before. We've had improvements in mental health. We've had people getting into jobs and training, and a range of benefits. What we want to do is widen the scope of the families where we're achieving those sorts of benefits. And in the meantime, I think we will also stop problems escalating to the point where it gets into the looked after system or other interventions.
One of the things we discussed amongst ourselves earlier was this reluctance of people to become involved with statutory services because there is a stigma involved with it, and there is the perception that things will get blown out of all proportion and escalate. And I notice in your paper you talk about working with the play scheme. Now, what we as a committee would hate to happen is that, for instance, a family would not send their child to the play scheme because they're worried that that's going to... they're going to, do you understand what I'm trying to get across? And also, the families that would be reluctant to self-refer because of the stigma and so forth. How do we overcome that?
Well, I think that's very much about having the right key worker that is a person the family trusts. I mean, obviously, whoever is the key worker, there are obligations if there's a child protection issue, which will override any relationship with the family. So, that's an obligation that we all have as professionals in the public services to report issues that have, safeguarding. But if it's below that level and there are issues, then it's having someone who can be trusted, who's going to be, in a sense, an advocate for the family. And often what we've found is that if you've got the right person who's made that relationship, you can persuade families to engage with statutory services in a way that's appropriate. And clearly statutory services don't want to intervene. If they've got a support worker delivering preventative services and that's working, they don't need statutory intervention. So, it's much easier as a non-statutory worker to build that kind of relationship, because there's definitely a worry when people engage with statutory services that something bad's going to happen to them, even though that isn't what the intent is and usually isn't what the outcome is either.
Thank you, Chairman. You've touched on this, Duncan. You said about communities first areas and say sure start. Well, the borough isn't covered wholly by these services. And are you sure that people won't sort of slip through the net because they are not covered by these services? I'd like to see equity for the whole borough, but, I can see it not working simply because the borough isn't covered by these services.
There is that risk. I mean, obviously some services are communities first, but families first isn't geographically based. Sure Start clearly is again. Welsh Government are looking at the moment on amalgamating those three funding streams into a single funding pot, and giving councils more flexibility about how the money is used and spent, which I think would be a step forward. So, I mean, we at the moment, most of the funding is through Families First for this preventive services, so it's not geographically based. And so we are able to make sure that it targets need. But certainly there are families in every bit as much need outside Communities First areas as there are inside. And there are similarly the same with Sure Start. There are children who are very much as bit need in areas with no Sure Start. And in fact, the trouble with Sure Start is that you can find that families have no needs at all, are primary users of it in many cases.
Looking at the appendices and the first part, the action plan may lead to a short to medium term increase in demand for services. Can that demand be met adequately? Are the resources there?
No is the short answer to that. What we have found is that the excuse me one sec, I'll draw a little diagram which you may or may not be able to see, but if that's supposed to be a semicircle, can you see it at the other end? So essentially, when the Families First was designed, that was the statutory services down here. So that's the sort of far end of the spectrum, the case people with the greatest need, where that's when social care are involved, child protection teams, statutory intervention. And Families First sort of said, well, those other two sort of groups of need, there's sort of medium and then there's low. So, and that's what Families First is geared towards. What we've found is there's a group here which is below statutory intervention level but have phenomenally high needs, who are on the verge of being in the looked after children system. And that's the group where we haven't got sufficient resources to support them. That's not to say we're not supporting them, we're supporting them massively, but actually there are more people in that category than had been envisaged. Doing two things about that. One is that, as I think Cabinet have just agreed, the Investor Save proposal for a family focus team, which will partly look at that group. And secondly, we've just put in a bid to Welsh Government for Investor Save money to set up services specifically for that group to release some of the pressure on Families First. And in fact, Dave Congreve and I are going to a meeting at Welsh Government on Monday to see. We've got through to the next stage, but we'll be interrogated about the proposals there and hopefully get some money to support it. So, but it is an issue. But I think it's important though that we map that category, and that's what we've been able to start doing, is having a better picture of just how many people fall into that category, because it's only when we know that the discussion about resources can happen. So the first thing is to find out how many people are in that category, and then then debate can start about how we meet it. And of course, it's possible that for other reasons more people are getting into that category, because of austerity and pressure on family finances and other issues that are going on in the borough. That we may find that more people fall into that category as welfare reform takes effect and some of the cuts in tax credits and things.
Duncan, going back to the thing you were saying about about the multi-agency, and indeed in the in our report, which was part from the Dog Walk On By, you were saying about the recommendation of looking at the multi-agency strategy. And you say about, although it will take time to become embedded, what would you say are the main problems of getting that system embedded?
There are sort of fairly sort of boring training issues around. There's a process to be followed with sort of standard forms and standard recording and systems and meetings that happen in the process. So there's people understanding what that is and following it. So that's a sort of, that's a technocratic issue, I suppose, in a way. But the bigger problem, I suppose, is that everybody is trained to work in a silo. Now, if you're a domestic abuse worker, you're trained on how to deal with domestic abuse, and that's your focus, your interest, probably, and your service performance is measured, and therefore your performance is measured, and sometimes your future job is dependent upon how many ticks you put in the box of people with a domestic abuse problem who you've helped in a certain way. So to say to that person, I want you to talk to them about employment and getting the kids into school, as well as domestic abuse, challenges the whole purpose of their service and how they are measured. So you're always cutting across a little bit about their funding priorities, their service priorities, and it's seen by people as an extra work. So what we're trying to do is change the culture, really, of saying, look, this isn't extra work. We're not actually saying you have to sort the employment priorities. We're wanting you to identify the needs on employment, and then we'll use a different service to meet those needs, but you then need to work with that service so you're both delivering something to that family. Because what would have happened in the past, they would have completely ignored the employment needs. And we're saying don't ignore it, don't walk by it, log it, assess it, bring your colleague who you need to know, or we will help you find the right colleague who does employment stuff to come and work with that family to help them on employment issues as well. And that in turn, you may find, helps in some way on the domestic abuse front, because if someone builds self-esteem, builds self-confidence, starts to, they may decide to leave a relationship and go somewhere else, may have independent finance from working to be able to do that. There's a whole range of other benefits. So, but that's quite a difficult model to get people to change to. So we're doing it. We've done a lot of work with the managers so far, and what we're now doing is working through the sort of single line management one-to-one process to talk through each of the services just how much they need to change, and trying really, I suppose, to say you don't have to change very much. You just have to keep your eyes and ears open and build it into this process. So we're not asking you to tear up everything you've done. We're asking you to do a little bit extra for the benefit of the person you're working with, but then you'll get extra resources in from colleagues to help you with it rather than working in isolation.
Again, you're saying about bringing different people in, or working with different organisations. Say for example, relationship with. Actually, we're talking about education, relationship with the schools, or relationship particularly with third sector organisations, which might. Again, they might flag up problems which are maybe not visible to a certain other organisation. Would you say that is? Would you say that we need to make sure that? And again, how do we get it moving? How do we get it moving that organisations that are working together, people like, as I said, schools, third sector organisations? How would they get involved?
Well, I mean, they are involved at the moment, and we're looking at that at the moment around how. I mean, schools is in a further. We haven't done the phase of engaging with schools so much, but if you look, for example, at the way the youth engagement framework is working at the moment, they're now having cluster meetings in secondary schools where they're talking over cases with the teachers in the schools. Looking at how to avoid children becoming not in education, employment and training when they leave school. So they're having advanced discussions around children's needs in the year 7, 8, 9 sort of category who will become in a couple of years school leavers, talking through a whole range of issues to do with that young person. And what we're looking to say, well, look, let's talk about the whole range of issues about the family, not just that young person. Are there younger siblings coming through who we need to provide to work with differently? Are there other issues going on in the family that we could address that will help the children's education as well as their future employment and training? So it's the idea is that there'll be there'll be this team around the family, and the role of the family support team, the family's first team, is essentially to coordinate that team, to identify who are the right people to be working with that family and who's going to be the lead, and to make sure they're all talking to each other and sharing information about the family and with the family to provide a sort of single family plan. And part of that family plan will be dictated by what's in the family think are the most priority, but also some of it will be around what the partners need to have done. If you are an organisation that's funded to tackle domestic abuse, you've got to show some outcomes, otherwise you're losing money. So it's not an easy task, but that's the intention.
So when they're working all in the agencies together, is there a criteria that has to be met for a referral to come in, and then obviously work's being done so they can signpost and make referrals to the different departments?
Yeah, I mean, I don't know whether Anne Sheehan showed you, but we've got a sort of continuum. Yeah, fine. Well, it's that, essentially. So if I may borrow that 1 second, I'll get it back to you, I promise, but I'm sure she'll get some more for you. But essentially, where is it? Oh, it's probably not in here. Yeah. table somewhere? No, not in that one. Oh, it's another one I'm looking at. But yeah, essentially, the idea is that there's a sort of four-tier. I'll give you that back. Four-tier model of one end is statutory intervention, another end is a single agency can resolve the problem. So, I know someone's got toothache, then a single agency can resolve the problem. And in the middle, there are sort of tier 2 and 3, where 2 might be a couple of agencies who can simply talk to each other and resolve the problem. But once you get to 3, you're getting to families that are more in that sort of spectrum, where there might be 7 or 8 organisations that really need to work together. That's the point at which we need coordination. And that's where you might get them together as a meeting to have a conversation. You get them to share data about, but also they need somebody who's the key worker, who's got a picture of, or that organisation's working with the young person in the family, that organisation's working with the mother who's experiencing domestic abuse. You've got a mental health worker coming in as well. Let's just make sure it's a singly integrated service. That's big. It sounds easy. It's not easy, but it's a start of making sure that it feels coherent. Because the families themselves describe, well, you know, I've spoken to families who say, well, somebody came to see me the other day. Who was it? I don't really know, and I'm not quite sure why they were there. You know, I mean, that shouldn't really be happening because they've just seen so many support workers. They don't know who which agency they're from and what they're for. But that almost says the conversation was a waste of time. They're probably really just coming to check they're okay. But we might be able to cut down the number of visits and make them more productive. Sorry.
Do you have an action plan, and how often do you look at it? And with that, is this strategy been subject to the LSB scrutiny?
We have an action plan, and we do what we call a RAG report. So it's a report to the Children and Young People's Improvement Board, where we either give a red, amber and green on the actions to show how well they're progressing. So I can very happy to provide you with that copy next time I do it, if that would help. And yeah, the local service board had a copy of the most recent RAG report as well, but that was some time ago, I think. But both the local service board and Children and Young People's in board just get they just get the report, and if there are issues, they get highlighted.
No.
Is that how you measure your success rate?
Well, not really, because the action plan is a sort of, is the actions. The real test is what the outcomes, and the outcomes are a little bit undeveloped, and we said in the strategy we'd be developing them. And the reason for that was because at the moment, under the Social Services and Wellbeing Act, the Welsh Government are planning to produce some outcomes for social services, some of which will be about prevention. Public Health Wales are also planning to produce some outcomes on public health, which is also part of the prevention agenda. And then under the Wellbeing and Future Generations Act, there will be some outcomes being required by Welsh Government. So what we want to do, and then also Welsh Government have only recently changed the outcomes that are now applicable to Sure Start, Communities First and Families First. So what we want to do, I suppose, is to wait for the outcomes to come out of public health, social services and wellbeing, and take those 3 sets of outcomes and the ones from Families First and essentially merge them into a coherent set, and then to make sure we measure those. Having said that, we do already measure outcomes for families. So, for example, in Branavon we've got one small project that's funded by Families First for staff or so, and we've just done an evaluation which got some outcomes which I'm very happy to share with you if that would be of interest. So we do measure the outcomes, but what we don't have is a single set that can be measured across all the different services. And but again, that's a real challenge because everybody's measuring their own different outcomes, and often quite narrow ones. So, for example, we had a conversation with health about who do some early years work funded by Families First, explained to them that we wanted them to record the number of young parents they'd helped into employment, and they sort of looked, puzzled looks, why would we do that? Well, because that's one of the outcomes that Families First are trying to achieve. So you're supposed to be doing something to help with that, but we only deal with the children. So that's the mindset. We've got a big change in mindset there. But it's not their fault. They're funded. So all these services are funded to do one little narrow thing. And one of the conversations that Dave Congreve has been having with Welsh Government is, you really do need to broaden the funding criteria, because if you narrow those funding criteria, you're not really meeting the full family needs. You're just chipping at a little bit of the edge without getting to the underlying issue that needs resolving. And it's such a waste of money and time. And it's not helpful for the family. They don't get as good benefit. So we are trying to turn quite a lot of different systems on their head. So it will take a while to do that. But internally and in the partnership, I think we're all very much on the same wavelength. It's just that we don't control the funding at the end of the day.
I think we are quite reassured to hear that, because we were concerned that the overall success of this would be down to purely the fact that we are looking to reduce the number of looked after children, and we were concerned that that would be the one driving force, and so we're particularly pleased to hear.
I mean, that is, I hope we will have a reduction, as I'm sure we all do, that looked after children. But, I mean, I think, we set out in the strategy the range of outcomes we hope we will achieve, and it wasn't just looked after children, although that was one of the outcomes. But there are a wider range of outcomes, and if you look at the, if I send you the evaluation we've just done of the project that's funded within Bronavon, you can see there's a whole range of positive outcomes around school attendance, around jobs and training, around mental health, as well as those sorts of things, and it can make a big difference, I think.
Anybody have anything else they wish to bring up? Nigel?
Yes, could I just ask, would, in your opinion, where are the strongest links in these in this project, and what's the weakest links in these projects? Be it organisation, be it the actual coordination, be it a particular area of it.
I don't know really. I mean, I think at the moment, the strongest links we've built is with all the services that Dave Congreve manages and the services that Bronavon manage, and that's because we're the two leads. We've used our own services to start the ball rolling, making sure the processes are working, getting the integration, getting people talking to each other, and that's so far been pretty successful. Health, I think, are the biggest difficult area to get into because, well, for a whole host of reasons, health is almost impossible to understand how they managed, and who's responsible for what, to be honest. And they're very set in their ways around how they do business. So getting them to think about anything other than the health of the individual they're dealing with in a wider family context, and where does this fit in, is going to be hard. So for sake of argument, if you want to get young children immunised, that's a health issue. It is a health issue, but actually it's a parental behaviour issue. It's not really a health issue at all. Absolutely nothing to do with health. It's to do with parental behaviours, parental interest. So, it isn't a problem that health will be able to solve. It should be a problem that a preventative service can help to solve. So there's a range of issues like that they see as a health issue, but actually it isn't really at all, and they're never going to have any impact on it, frankly, if they only see it as a health issue. Even smoking is another issue. It's not really a health issue at all. Health issue is a behavioural issue, and it's a stress issue, and it's about poverty and deprivation and lifestyle, and it's nothing to do with health, really. Health, you get a health benefit if you stop smoking, but that's the only bit of it is to do with health. They don't really quite venture out of that silo, in my experience. So there's a lot of thinking and talking to be done around how, and to be fair, there's a lot of work going on in the smoking arena at the moment. It's not specific to this, but around them realising that their smoking cessation projects are great up to a point, but actually they're never going to get the right people to go to it at all. I could name 50 people I know who smoke really heavily and never going to go to those projects. So they're wasting their time in terms of trying to get those people to stop smoking that way. If they went to the person's house, they might get them to stop smoking by a different way of working with them, or finding other reasons, thinking about why how can we relieve the stress on them, for example, and think of good ways for them to spend the money they'll save, and all sorts of other reasons why one might stop smoking, or talking to them about the impact it's having on their children, but on a face-to-face basis with their children in the room, sort of thing. There's a lot more could be done. And then the measure of success of the smoking cessation project is how many people attend. It's not how many people stop smoking, which is crazy, isn't it?
Duncan, in your report on page 24, you say we need to strengthen our knowledge of family needs in order to predict and plan services. And you go on to say, in particular, we need to improve our intelligence about mental health. How are you achieving this?
I've only got an excerpt from the page.
Page 24. Sorry, Duncan.
24 is number 2.
Yeah.
Okay. Thank you. Sorry, apologies. I've only got I've only got the report. I haven't got the whole agenda.
Oh, sorry.
So it's no problem. Anyway, yeah. Yeah. So you're asking about the mental health issue.
Well, both. You
Okay.
say you need
so need to strengthen our knowledge of families. Okay. So the first bit is about So we need to be better at predicting which families are going to need help before they need help, in order to stop things happening that will otherwise happen.
How are you going about that, then?
Well, essentially we pretty much one of the interesting things about when we looked at this is that a lot of the support services already have risk systems. So the health visitors have risk systems for young children. The youth engagement framework has a risk system for NEETs. There's a risk system for child sexual exploitation. There's a risk system. So there's a whole range of risk systems, probably about 15, 20 of them. And what we're saying to the services is, don't tear up your risk system. Use your risk system to trigger a risk, flag. Build them into the family support system then, because if there's a risk in one person in the system, there may well be other risks in other services. And what we will use is try and get them in the... So there's a domestic abuse risk profile as well. There's a whole range of different risk systems. So we're going to try and use those systems to get families into a database, so we know which families we think will be at risk, and then try and make contact with them low-key and find out a bit more about them, make a connection, build some trust, and hopefully avoid any risks that might materialise in that way. That's the plan. So that's that bit. In terms of the poor mental health, we did a report. Again, I can send it to you if you want it. If it would be of any interest to you. On looking at assessing the information we held on you about domestic abuse, substance abuse and mental health in the borough. And the reason we chose those 3 areas because they are absolutely the prime drivers of child protection, safeguarding, family breakdown. And those so they're absolutely the drivers of that category, or the 2 categories of need actually. Both those last 2 categories of need are driven by substance abuse, domestic abuse and mental health problems, particularly of mothers. And what that assessment showed is that whilst we know we're pretty good on knowing how many families are experiencing domestic abuse, and we're pretty good on substance abuse because the kaleidoscope of delivering a service, and fortunately there aren't too many of people in that system, but they pretty much know which families or which individuals are involved. The one area we're really, really poor at is mental health. And the reason for that is that all the services define mental health differently. We haven't got a clear single definition of what we mean by a person who has a mental health problem. Secondly, people don't want to define people as having a mental health problem because there's a stigma attached to it. Thirdly, a lot of the systems, for example, the police don't have a computer flag for mental health problems. They record in their individual files that a person has a mental health problem, but they don't record it on their computer system. So, which is pretty crazy in my opinion. But anyway, there we are. So a lot of services weren't able to say how many of their clients had a mental health problem. So the reason we put that in was because we need to do something about that. Because if mental health is a driver of problems and demand, we don't even know how much there is. We have no idea what services we need to help stop that. And so we're in a bit of a pickle, in fact, from a mental health data point of view. Yeah.
Sorry, Duncan.
So that's why that's in there.
So we don't get any reports really of GPs that they're with families.
Nowhere.
No.
So we've got no single database. When we're, we all got the council in particular and healthcare go to great lengths to plan and strategise about services. When they're doing so, they have no information about mental health. Yet mental health is a huge factor. When we did a study, this was self-assessment. We did a survey of tenants in our some years ago. Well, in fact, no, actually, more recently, the Department of Work and Pensions got some academics to do a study of our tenants on housing benefit. So that's 75% of our tenants are on housing benefit. So of those tenants, 29% identified themselves having mental health problems or depression. So that's quite a big number of people, and that was just amongst our tenants. Now, okay, there'll be other people in the borough, many other people in the borough who have mental health problems. And that wasn't older people either, it was younger people. So it was, it wasn't people with dementia and things, which is a different mental health problem. So, yeah, so it's a big, and we haven't come up with a solution of what we're going to do about it, but we're going to have to define it, and it really needs to be done on a national basis rather than just Torvine, because, to be honest, if we start doing it and no one else does it, it won't work. And anyway, Social Care are commissioning a massive computer system for the whole country together. Their system will be designed to record something about it, we hope. Doesn't make sense for us to devise something differently. But it is a weakness in our planning. We're supposed to be designing services, and if we don't know how many people are suffering from a mental health problem, then we can't design services, really.
Thank you. I am a bit conscious of the time,
Sorry,
but
yeah.
I know Mandy, quickly.
I just wondered if you had input from CAMS.
Well, we haven't had input from CAMS. No, we've been working with CAMS or working as far as we can with CAMS. They're a bit elusive, to put them mildly. So we, CAMS is I've been in regular contact with the Minister about CAMS because I think there's a lot of work to be done to make sure that there is a coherent child and adolescent mental health service. And when I say coherent service, what I mean is from the stuff that is done in preventative services, just talking to people and building self-esteem, self-confidence, that's dealing with mental health at a very low level. We all deal with our own mental health from day to day by having a conversation with our partners or whatever, because we're feeling a bit low. That's the very one end of the spectrum. The other end is obviously clinical people who need medication or even being detained in some cases because they're a danger to themselves. But there isn't a system, really. There is a service that delivers the medication end, but it's so difficult to get into, and there's a big gap, I think, of information and services in that sort of middle range. And it's interesting, isn't it, that if you go into hospital for a medical problem, well, for a physical medical problem, a consultant would see you, and then the consultant would say, the GP will be doing this, the physio will be doing that, the nurse will be doing that, you'll get, the surgeon will do this bit, the x-rays will do that. So they sort of manage your package of services. If you go into the psychiatric problem, that isn't really the role that the psychiatrists are playing. And so they're not commissioning the services below them. They're almost just saying, you haven't got a medical problem, goodbye. and we're left with somebody who's in limbo, really, and parents are tearing their hair out, I think, waiting a huge amount of time and then going to see a psychiatrist with their child and says, it's not a psychiatric problem, I can't deal with it. Okay, but I've got a child who I can't cope with or isn't coping at school, now what? So there's a big gap there. And we put it in because we knew it was a problem, but we haven't, if I'm honest, it hasn't found a solution.
Thank you. I am conscious of the time, and I do want to move things on. Just one last question, Duncan. Are you happy with the level of progress to date?
Yes, I am happy with the level of progress to date. I mean, things like CAMS were frustratingly slow, but when we launched the strategy in March, which is only 6 months ago, made a lot of progress, and a lot of it is behind the scenes working with managers to get them to change the behaviour of the teams, and that's a very slow process. So, yeah.
I'm going to say thanks ever so much for your very in-depth, comprehensive answers.
And I'll send you those two.
Sure, please. Thank you. Okay, thanks ever so much for coming in.
Do you think there was a choice there?
Well, there wasn't, but I always try to be polite. As you appreciate, we've all read the report and we've visited the staff on Monday and we've had an in-depth, actually, really interesting discussion with the two people that have come before yourself. I'm conscious that we don't want to revisit the things we've already discussed about, but basically, as far as you're concerned, how are things changed from what we used to do previously?
Okay. For those of you who've known me for some time, I think you'll be aware that I've been very conscious that there hasn't been an early intervention policy in Torfaen, and it's something that I've talked about in this chamber many, many times, about the lack of an overall strategy means that by the time children come in touch with social care, it's often too late. So I think already we're beginning to see that there are some changes, and that children are being looked at on a much more multi-agency basis. People are not just simply thinking, oh, that's a problem for social services, we'll make a referral. People are beginning to try, and I say beginning because I think it is very early days, beginning to try and deal with things as they see them. And I think that does, links to the title of the thing, don't walk by. And I think that's how it should be. I think we've had that with education for a number of years. They've tried to deal with things in schools, but very often felt a lack of confidence in dealing with it, because if they feel there's anything which might even have a smattering of child protection or safeguard, they feel they need to talk to social care. So I think it's the beginning of a journey, but I believe that it's a very promising beginning. And I'm looking forward to seeing how it does develop. I think we're on the right road. And I think that children and their families will get a better deal through this.
When we've scrutinised things in the past where there have been multi-agencies involved, one of the biggest problems we've always found is that the left hand didn't know what the right was doing and things fell through the middle. And with such a huge remit and so many different agencies involved, how are we going to make sure that doesn't happen again?
I think the partnership board is beginning to pull those things together. I think one of the frustrations, when you did a mapping exercise in terms of what family support was available in the borough, there was a lot, but there was no real coordination, and very, very difficult to coordinate. So you'd have things going on in a community's first area, and so and that couldn't be replicated everywhere. So there was a real frustration that you couldn't pull that together. And I think we've made representations to Welsh Government about that. It give us a bit of freedom, actually, because actually what we want is this service to be universal. It should be available to all children in the borough, not just some. So you get some children getting a good service, some getting next to nothing. The same with the Flying Start, you know. And I think if you'd had an overall coordinated service, it would have made much more progress quicker. But, you know, we are where we are, and I think we should embrace it and think that it will I think the will is there around the table now. I don't go to all of the operational meetings, you wouldn't expect me to, but the soundings I'm getting, the evidence I think we're beginning to see is that multi-agency working is really beginning to work. And I suppose, you know, the impact will be seen probably months, years down the line when we hopefully see the number of looked after children declining. I think we'll always have a certain number, that's inevitable, but or that some children will have shorter episodes in care and actually be rehabilitated home quicker. So I do think that, you know, through that partnership, it will happen. I think, I've got to be honest, I wouldn't say it to his face perhaps, but Duncan has been very, very instrumental in this. He's really driven it. But I think when you're outside of the council, and I don't wish that to sound rude or it's easier to ask some of those questions sometimes and to challenge across departments, whereas I've said it in various forums with colleagues, it hasn't been their priority, and rightly or wrongly, at times people work in silos, and they're thinking about their immediate priorities that day, aren't they? Not what actually should be a strategic vision. So, you know, I can only say that I think it's a great endeavour.
When I was reading the overheads that we use for the staff training, one thing that really concerned me, when it was talking about introducing the lead worker role, it says quite clearly, the lead professional is responsible for helping make sure that actions are carried out at the right time, but it is not held responsible for the actions of other services carried out. So that, to me, would say, I've identified this problem, I've passed it over to you, but then that's where my responsibilities stop. So how do we know that if we refer something to another agency, that will actually happen?
This has been one of the more contentious areas to develop in truth, because I think people are very concerned about being the named professional or the lead coordinator, because with that comes some responsibility. But I think, you know, the responsibility is also to hold others to account, and if they feel that colleagues in other agencies are not doing what they need to be doing, then there's a way of, if you like, pushing that up the chain to their manager or the managers within that other department where that challenge can happen. And that happens to an extent now. You know? There's a way of accelerating it up the chain of command.
One thing I was particularly pleased, when we were talking about the lead worker, and it said everything is decided in partnership with the family. So I was reassured to say that we are not having lead workers saying, this is what's got to happen, and it will happen. It is done with the family, because we were discussing this earlier, and most of us here are parents. We've all been through the problems parents have, and a lot of the time we learn through our mistakes. We get things wrong, and next week when the same problem we don't make the same mistake again. But on the other hand, are we going to end up with a cohort of families that don't experience that because we're intervening too much? We're not allowing families to learn by their own
I don't see that role necessarily like that. And I think you've got to tailor that intervention to particular families. Yeah, we all vary. We all parent in a different way. We all live in a different way. One of the very good examples of the way the key professional, the lead coordinators work, is with services for children with disability, and I think it's a really good model. And the key thing there that we've had fed back from parents is about communication, about somebody pointing you in the right direction, not necessarily doing for you, but actually acting as a conduit to, well, you need to ring that, or you need that appointment, and that really does help them. It doesn't take away the responsibility. Now, sometimes you've got to take people along with you because they lack confidence, know, they hold professionals in a certain myth. I mean, I think when I first qualified as a social worker, I wouldn't have challenged a GP. You just didn't. You know, I don't think I'm in that position now. I've probably challenged them too much. But, you know, I think you develop that, don't you, as time goes on. But I think it's about giving parents the confidence to know that they can ask those people. Those people will, you know, if you like, guide them, point them in the right direction. And that's it's not just doing it for them.
Thank you. Where would you say that we have the strongest links, be it at levels at organisation or between organisations? And where would you say that there are links that need to be improved, strengthened, or even to be there, to be there at all?
I think within the council we've got some very strong links, particularly with education, the youth service, the play service. We've done lots of work with them over the years. We've got some very good, well-developed services with Action for Children, as you know. We've got MIST, we've got TOGS. We had good service with Bernardo's, you know, so with some of the big independent organisations. I think probably where we need to do some work, and I don't think it's just in this area, speak now, I suppose, with my Deputy Chief Officer hat on, is within the local voluntary and independent sector. I think that's quite underdeveloped, and I'm not being critical of them at that. I think if you want to commission something, you've got to signal your commissioning intentions, and perhaps we haven't been particularly good at that. So I think that through this, there will be things that we can ask for TVA to do, and so on. And they come to a lot of the meetings, but attending a meeting actually isn't being a participant. You've got to actively do, and again, I'm not having a go at that. I think we've got to be, you know, they're all very supportive about what we're trying to do, but it's like coming to the table with other things as well. And I think there's a lot of research to say that actually families engage much better outside of the statutory services. If they see my staff turn up, they think suspicion of social workers, you know, the news say social workers take children away. We do. Here, but actually we also do a lot of work where that isn't the case, so we've got to try and dispel so that. But if you like, one of the reasons for using Action for Children or one of the big charities is they don't have that stigma. Parents are more likely to go through the door. Now, you know, I think you can overcome that. We can overcome that with some of the work that we're doing with Bronavon, Mellin. You know, they don't have that statutory intervention. But what they've got to do is they've got to be honest with families and say, if we identify a safeguarding issue, we will refer it to social care, because that we're duty bound to do so. So I think I'm not sure. I think I've got off the point there, Councillor. But
I would say that, but I would say it's one of the things that we are concerned about, as well, to use the awful cliche, so as strong as the weakest link, and sometimes sort of where weaknesses might be with different parts of the system, and even with statutory authorities, that may be that they're not as strong as you or they would like to be. Your links, or indeed the services that they are offering.
I think one of the challenges we've got there, though, is I think people have identified where families needed a service, but they think there's no point ringing social care. They're only dealing with children of a certain threshold, so they won't take it on. We might signpost, say, have you tried this? So we've got to get people to understand that those services are there and they're developing, and they've got to, you know, if they don't ask, we can't gather the unmet need, so you then can't develop the services. So I think it's about building that confidence. I mean, some schools are absolutely excellent at picking up the telephone and saying, we're not sure what to do about this. What would your advice be? And, you know, we can say, well, that isn't for us, but have you tried X or Y? Have you talked to Julian in the play service? He might be able to provide some support. And, you know, it's that, but I think it's people beginning to see that it isn't just a statutory service that's being offered, that, you know, because for a long time that hasn't been there. And I think that's the reality.
It's following on, really, about social workers, you know, and they're seen, you know, to take, well, split families up rather than to keep them together. Point 5.20 in the report, the second part will reduce caseloads and will allow more time to work on early intervention and support the wider intervention and prevention strategy. Currently, the highest number of cases open to the social worker is 31, which is enormous. And you say we expect over time for this to reduce. Is it reducing, or aren't you at that stage yet to find out whether it will?
We're not at that stage. Actually, I met with heads of service across the former Gwent authorities, and we've got the highest caseloads of any of the authorities at the moment. I think you'll have heard that we talked about Lord Laming's report some years ago of caseloads in the region of between 15 and 18. Well, we run at the average is 26, 27, the highest 31. Colleagues in Blaenau Gwent are talking about 17. Blaenau Gwent, Newport 19. So we're out of step there. But obviously we understand the council's position in terms of finances, and it's hoped that this early intervention will bring the caseloads down, and that we won't necessarily need less social workers, but they'll have more time to do the early intervention and direct work that families need. At the moment, if you like, we run almost a crisis service, and an awful lot of our time our staff spend in court, in proceedings, huge amounts of paperwork, and I think don't have the time. When I was a social worker, my manager, when I first qualified, said, take that boy out and get to know him and see how he ticks. We wouldn't even dream of saying that today. Now, perhaps that was the other extreme, but you did get to know children and the family. And I think, for whatever reason, we've moved away from that in terms of getting to know them, getting to understand them, and trying to, rehabilitate them through that work you could do with the family. It just doesn't happen now. And again, that's not unique to Torvine. That's UK-wide. People don't have those services anymore, and it's probably a retrograde step that the number of looked after children in that time has gone up over those years, hasn't it, across the board.
Keith, last question. Hopefully. How do you measure your success? I appreciate it's not been going long, so therefore you can't do it at the moment. But are we just measuring success at the reduction in the looked after children, or is it going to be much wider than that? And when will you feel you'll be at a point where you can say, yes, this works?
The success will be measured in a number of ways. One will be the reduction in the number of looked after children. But if children need to be looked after, they need to be looked after. There isn't a quota. If I go out of here today now and someone says, we've got 5 children to bring in, Keith, and that's the only way we can keep them safe, obviously I'm going to ask some questions, but then I'll say bring them in. We won't risk it. But hopefully we'll see a reduction in the looked after population. We'll also see a reduction in the child protection register and the various categories on there, particularly I think around neglect. I think. Sorry, I've lost my thread there. Looked after, yeah. But I think the other thing is, of course, Welsh Government have yet to publish what the outcome framework of the new Act is. And I think some of that we'll measure. I think one of the key things that we do look at is the number of re-referrals we get to the service. And if we have a high number of re-referrals on any one case, that would sound alarm bells to me. Something's not right. The intervention hasn't been sorted out. So sometimes it can be for something that's absolutely completely different, but sometimes it can be that we've been overly optimistic, or the family have told us certain things have changed and other professionals have agreed or whatever. But so I think that there's key things like re-referral, so that once there's been a successful intervention, that child, that family shouldn't be referred back. Now, it could be for something completely different, and as children, very young children, as they go into adolescence, things change. Parents sometimes need different advice and support. So I think, it's around those key things. It isn't just about the numbers, though. I think, it's the numbers, the reasons, that's the crux of it. Why are children becoming looked after? Now, I think that very often, and again, I've probably said it earlier, and I've said it numbers of times in the past, by the time they come to us, it's often too late. my only option is to say we'll have to accommodate these children at huge expense to the council, and to the taxpayers. But, what do we put first? Safety of children or the cost? And, I think we've always agreed here that safety first.
I think as a committee we are reassured to hear that, because one of the things we did discuss earlier was we would hate that the criteria just be changed, and in 6 months, 9 months we hear of a child that is injured or killed or whatever because we didn't take them into care when previously would have done. So I think we are reassured by what you've just said. Anybody?
Sorry, Chair. Page 44, Keith. You looked after children. Between 2005 and 2011, the number of looked after children in Torfaen increased by 61.6 per 10,000 of population. Since 2012, there has not been an increase in the number of looked after children, but Torfaen remains above the Welsh average. Could you explain that a little bit more?
There's a number of issues there. Around the time of the big rise, we had a number of children. Again, it was common practice across social services across the UK to agree that children couldn't remain with their family, but to agree that they could live within the extended family or friends, but they didn't become formally looked after. We paid them an allowance out of Section 17 of the Children Act, which is a way of providing some resource to do. And in essence, we were advised legally that we were probably operating illegally, that once we'd identified a child needed to be looked after, then they should be formally looked after. And again, it was just what, we bunged the family a few quid and said, there's 30 quid a week, look after them and, get in touch if you need any further support. And for many children and families that worked, but actually it wasn't legal. So when we addressed it, we had to bring a number of children in under Regulation 38, which meant we had to assess the families to say that they were suitable. We always did the checks. We always did the lateral checks with the police, etc. We never just placed children. We were satisfied. And I think, for many of those children, that was probably a good outcome because they remained within the family. Once you start getting into a formal assessment, and people, if you like, have to be cleaner than clean, then that often wouldn't work. And I think, we all have a view on that. Life isn't perfect, is it? And sometimes children need to take the chance within their family. And I think lots of evidence has suggested once they're 16 anyway, they go home. Despite what's gone on, they vote with their feet and go home. But they're then able to make a decision. So that was one of the reasons. The other reason, I think, is that we have high levels of deprivation, no early intervention, and therefore our numbers are higher. I'd have to say, and again, I know from colleagues who work in other authorities, some of them still operate on the bung them a few quid, and that is that. I'm not being trite. I know that happens, but we were advised legally not to do it. And I think what we do it properly. If you like, when we looked at DFGs on a number of occasions, and we were saying what we report is absolutely accurate, and people are not always counting apples and apples; they're counting apples and pears and oranges, and that's what it is, But our looked after population, in my view, is too high. I mean, I'd be the first to say it, but it's too high. But at least I know those children are safe. Yeah.
Does anybody have anything else they're asking? Keith and Peter, can I just say thanks ever so much for coming along, although you never had a choice, but we appreciate.
Well, it's nice to still have the job.
The access you come. Thanks ever so much.
All right. Cheers.
Right, we now have to come on to the recommendations. So to make sure I think we've identified a number of areas, mental health being one. We need to improve the communications all around mental health and improve. The other one was the good point you brought out, and you always do, the one about the third sector as well. We must. Anybody else? No, but I know you were. No, that's fine. Great. About to make sure we get an equitable service across Torvine, irrespective of what area a child or a family lives in.
Yeah, I've always had a bee in my bonnet about that, to be honest with you. And I've still got reservations that they might be missing out, you know, some areas, some wards that don't have the communities first and the flying start, sure start or whatever. I think that's got to be looked at, you know, and make sure that nobody falls through the net, as I call it. Because if they're looking for early intervention, that's what they need, early intervention.
I mean, I thoroughly agree with you, because I know within my ward there are certain small pockets of very deprived areas, and it goes right back to the time when there were council houses and you put all the rough families in one small area and they can basically fight it out amongst themselves, and we've still got pockets like that. So I think it really is important that no matter where a family lives, they get the same level of service. Anybody else want to bring anything up? Barry?
I've just got to say I've got to support Councillor Parish and yourself. You know, we've got to be concerned about every area in Torfaen, not just the deprived areas, because this happens, don't matter where you live. So that, I think, should be one of the top priorities in this.
Say, Chairman, they did mention that the Assembly were looking to spread, how can I say, spread it round more evenly. The sooner they get on with that job, the better, as far as I'm concerned. But I don't suppose we can do much about that from, you know, from a committee like this.
I think I was quite pleased to hear that the Welsh Assembly are hopefully in the future going to give the money to the local authority, and the local authority decides how it's spent, because we know our residents, the Welsh Assembly don't. So hopefully we can put a word of recommendation about how we would like that to be progressed.
I think a previous recommendation the committee made was for the executive member to lobby Welsh Government on exactly that point, so we could reiterate that. So just to recap then, for recommendations, there's something around communication strategy, which would include all stakeholders, such as clients, and to include advertising, how to access services, progress updates, learning between professionals. Also a recommendation around investigating the gap that exists with the CAM service. A recommendation around some work to be done collectively on producing a definition of mental health problems. And a recommendation around developing the alliance between the voluntary sector and strengthening the voluntary sector.
The other one I felt was very woolly, shall I say, was when we asked questions, how do you measure the success? We didn't actually seem to be able to... I don't want to ask for performance indicators, because that's going to be really difficult, but I think they should develop a more robust method of deciding whether this is actually value for money. Everybody happy with that?
Yes, because, I mean, the panel, as I mentioned before, all these agencies, organisations already exist, and they're going to be used in a different way. Well, we want to see something come out of that, don't we?
But we want to be able to see visible...
No, and just to get them to share with the shared outcome measures when they've got all the well-being acts come.
Okay,
Also, one other thing about how we get particularly schools, how do we get the school, make sure the schools are on board, also and also GPs as well. Okay. And the other thing about it, which I think we're still a little bit unsure about, is the actual criteria for early intervention. There's still that feeling about where do we start, and at what level and in what place and to do with what thing, but again about
so you're actually talking about accessing the system. That's
and also and when, where, and how, and all the rest of it.
Okay, well, what we'll do, Helen and I will work together. We'll come up with the recommendations, as I've done before. I'll email them out to you, give you a couple of days to read them. If you want to make any amendments or any suggestions, then you email them back to me. And then okay. Right, so we go on to item agenda 7, for the last time, summary and executive decisions on page 55 to 60. Anybody got any comments? They've already happened. And as I say, this is the last time this item agenda will come here. Okay. Agenda item 8, discussion on item for the next meeting, which is on the 11th of November. Helen?
Yeah, the next item was selected at Visioning, and it's safeguarding in education non-maintained settings. We also decided on the key question to be answered, which is, can the council have confidence that early year partners have acceptable safeguarding processes in place?
I think the thing to emphasise, this is not schools, this is the other bodies that are not run by the council, things like nurseries and so forth. So we will look at some appropriate places to visit, which will be quite interesting. And then I'll email them out to you, and then we'll work together to work on times and places to visit.
11th of November, is that at 10 o'clock?
Yep, but obviously I'll email out to everybody in plenty of time so that they can all organise their own personal diaries. So if nobody's... Quickly one.
Just one thing about, of course, it being the 11th of November, is that we must remember, of course, with the 2-minute silence on 11 o'clock. Because it's the 11th of November.
Right. I'm sure we can work round that somehow. If we have to adjourn the meeting for half an hour or 10 minutes or whatever. Okay, nobody's got anything else. Can I just close the meeting just before 3:30 and say thanks everybody for coming and for your engagement. Thank you.